you're my patient, and then we're gonna go out and get lunch.
Oh, nice to meet you.
Why does it feel like you're flirting with me? Anyway, hi guys, welcome to today's video. In today's video, I'm actually going to counsel my boyfriend on Apixaban. He does not take Apixaban, but actually, like, obviously as we're in national lockdown and I have my FS1 assessment next month, I was like, you're gonna be the patient, I'm gonna counsel you, and you can ask any questions, and I thought, let's film it. So that's what we're doing today. I'm gonna act like I'm the pharmacist on the ward and you're like the patient lying in the bed. And basically you've suffered from, unfortunately, what your father has suffered from. Can I say that?
Yeah.
Which is a pulmonary embolism. Just act like you would if you were a patient in hospital. I don't know why I'm so nervous, right? Also, I've got a list here, so like I'm not doing it from memory because my brain's not there today. So it might be a little bit patchy, and obviously you can tell me in the comments if I've missed anything, which I'm sure I will. So we're both gonna learn from this today. Okay. Hi.
Hi.
My name's Regina, I'm the pharmacist on the ward. Yeah, yeah, but I just realised something now.
What?
I didn't ask who you were. I was supposed to ask who you are. Okay, guys, this is why you need to be honest, in an actual counselling, I like to just do it how it feels. Like I really don't like the fact that we have to go through this whole consultation like pro forma. Anyway, let's try this again. Hi, my name's Regina, I'm the pharmacist on the ward.
Oh, nice to meet you, Regina.
Can I just confirm that you are
Ed.
Ed? Yeah, is that
Yeah.
right? That's fine. Okay, so I've just come to talk to you about one of your medications that's recently been started by the doctors. It's called Apixaban.
Sure.
Do you know why it's being started, or are you kind of aware of what's happened in the past few days? Or
No, I don't know much about it. Can you please tell me more?
yeah, so basically you've suffered from a pulmonary embolism, which is basically when a blood clot has blocked one of the blood vessels in your lungs. And so to prevent and to treat that blood clot in your lungs, and then to prevent it from happening again, you've been started on this drug called Apixaban.
Okay.
It works in the clotting pathway in the blood and basically treats the clot and then prevents it, hopefully, from occurring again.
Okay.
Does that make sense to you? Like, genuinely, I'm talking to you like, as it, like, would that make sense to you? If you...
Sorry, I wasn't listening.
Oh my god, you're so rude! What's a PE? What's a PE?
PE?
Yeah.
I don't know, what's PE?
A pulmonary embolism, I've just told you. So what does it mean?
Pulmonary embolism.
Oh my god.
Does the patient need to know that?
No, I'm just... Yeah, because it's happened to you. You've suffered from a PE. Do you not want to know what that is? So yeah. It's important that you do take this medication and that you take it as we're going to discuss now. One thing I just want to say is that everything I tell you right now is going to be written on this patient information leaflet. So don't worry if it all goes over your head and you forget it. You can also, when you're discharged from hospital, speak to your community pharmacist as well. So yeah, don't think I need to, like, you know, remember all this right now. But I'm just going to go through a few points.
Okay. What happens if I miss it?
What do you mean? Oh, you miss a dose?
Yeah.
Okay, if you miss a dose, then obviously if you remember it within 6 hours, then we recommend that you do take it. But if you don't remember within 6 hours, then just take your next dose, if that makes sense.
Okay.
So the dose you've been given will be 10 milligrams twice a day. That will be for 7 days. And it will be 5 milligrams twice a day after that.
Okay.
So we talk, yeah.
Is there a specific time I need to take it, or?
Well, you know, I was gonna tell you, but if you've got so many questions that we just want to mess up the order, then fine.
Yeah, please go ahead.
You're supposed to take it at the same time every day. Like, that's what's for the best, you know, effective treatment. Twice a day, that would be morning and evening. But it doesn't matter with Apixaban whether you take it with or without food. That's not really a concern. You can just take it morning and evening. So I would recommend probably like maybe 8 o'clock in the morning and then 8 o'clock at night.
Okay.
One thing I want to tell you is that if you experience any side effects such as black tarry stools, or you vomit up blood, or there's blood in your urine, or anything like that, just to stop taking the medication and seek medical help as soon as possible. And that's the same for if you, say, bang your head on something and you start bleeding.
Makes the blood a bit more watery.
Watery?
Yeah. Isn't like...
I guess it would take longer for it to stop, you should stop bleeding.
Okay.
Yeah. Which is why it can be dangerous, so seek medical attention immediately. So your dose might need to be reduced depending on your kidney function.
Okay.
but that will be monitored by probably your GP. You'll also have your full blood count and your liver function test as well, but again, that will probably be done by a GP. If you're thinking about taking any medications over the counter, tell the pharmacist, I'm taking Apixaban, can I take this drug as well, just to make sure. And we don't recommend that you take anything like ibuprofen. If you're going to go for an over-the-counter painkiller, we suggest paracetamol, and that's because ibuprofen with Apixaban can increase the risk of a stomach bleed.
Oh, okay.
Yeah. Do you want to ask about alcohol?
Yeah. Is there anything I cannot eat or drink while I'm taking this drug?
No. So alcohol is not going to affect the levels of the drug itself. If you're drinking a lot of alcohol, there's an increased risk of, like, say, accidents happening where you slip and fall over or whatever. And for that reason, we just say try not to, excessively drink alcohol, just because if you have a wound or something like that, again, that would be quite dangerous. Are you taking any contraception? Is there any chance that you're pregnant? Okay, so if you are going to your dentist or anything, again, that requires work where there might be bleeding of the gums and stuff, so make sure that you tell the dentist I'm taking Apixaban so that they're aware, and that you can, for example, stop it before your treatment or anything like that. And you can obtain further supplies of this drug from your GP.
I'm suffering in summertime from hay fever. Would that affect
any interaction? Do you know by any chance what that drug would be?
Just over the counter.
Like Piriton. As far as I'm aware, there are no interactions between antihistamines and Apixaban, so I think that should be fine. But if you are really concerned, when you are purchasing it over the counter, make sure that you do tell a pharmacist, and they can get the most up-to-date information on that. And obviously, for further advice, if you've got any further questions whilst you're on the ward, then ask for the pharmacy team. I'm always here and I'm able to speak to you, or one of my colleagues will be able to. And obviously, when you are discharged, like I said, community pharmacists are really helpful. So all of this will be in this patient information leaflet, which I'll give to you. I hope that you feel better. I need to go through this. You need to tell me if you think I did it or not.
Okay.
So I introduced myself.
Yeah.
Can you give me a pen? Oh no, wait, do I have one? I don't like getting tested on counselling because I feel like it's not as natural, and you're constantly thinking of stuff that you need to cover instead of like actually just listening and like talking to the patient.
Like
it's more like I'm spewing out information to you. Yeah. So did I introduce myself?
Yes.
I did. Did I confirm your identity?
Yes.
I did the second time round. Oh, did we discuss the purpose and structure of the consultation?
Yeah, you mentioned that like it's for me to know like, well, what is the drug for?
Did I invite you to discuss your medication? I guess, right?
Yeah.
Okay, did I document a full medication history? No, I actually didn't. But then as a ward pharmacist, I would already know what's on your drug chart. But maybe in community, I'd say, or an outpatient, I'd be like, oh, what other medication are you taking?
Yeah.
I'm going to put no, but
obviously I volunteer my information about the hay fever medicine.
Yes. Did I assess your understanding for prescribed treatment? Yeah. And did I talk to you about your understanding of your illness? Yeah, you weren't interested, but yeah. I didn't talk to you about your social history, like whether you smoke or anything.
No.
No, I didn't do that. Did I ask you how often you miss a dose? No, because you weren't taking it yet. Did I establish reasons for the missed dose? No. Identify and prioritize patients' pharmaceutical problems? No, that's not really relevant. Okay. Did I relate information to your illness and treatment beliefs? Did I involve you in designing a management plan? No, we don't. No. Did I give advice on how and when to take the medication?
Yes.
Did I check your ability to follow the plan? I guess I could have said at the end, like, do you have any questions? Do you understand?
Well, you mentioned sort of like if there is any questions, I can, there'll be pharmacists around it.
I checked your understanding and referred to other healthcare professionals. And finally, did I explain what to do if you have difficulties?
Yeah.
And provide a further appointment or contact point? Yes. And ask you if you have any further questions. I don't think I asked you if you had any further questions. Maybe that was the only thing I didn't do. There's behaviours, but we're not going to go through that. For example, did I demonstrate empathy and accept the patient in a non-judgmental or patronising way? I don't know. I don't need to do that, right?
You were really rude towards me. I want to speak to you.
Okay, well, thanks for watching this video. If you enjoyed that and you want me to do this with other drugs, and unfortunately at the moment, Ed is our only patient. But yeah, if you enjoyed that, please let me know, and I will see you in the next video.